Hi, my name is Dima. I'm Dima Jad, the Capacity Building Executive for AAA, and we are here with Mr. Uday. Please, Mr. Uday, can you please introduce yourself?
Hi, good morning, good afternoon, wherever you are there, whatever the time there. My name is Uday Al Ubaidi. I am the president of MedLab Tech Academy. I'm so happy to be here with AAA to give this webinar or the seminar. Thank you very much, Dima, for organize this webinar.
AAA is the American Accreditation Association, and we are recognized internationally by the US government to provide accreditation worldwide. So, AAA is located in Virginia State in the United States, and our international operation office is located in London, in UK. So our objectives, AAA is committed to main 3 points. First of all, provide international accreditation and promote the acceptance of the accredited results or certificates. So as we continue to strengthen our operation teams, like developing the capacity and capability to exceed the expectations of our customers and stockholders. So what are our accreditation services? We do serve in six services. First, we have healthcare accreditation, training and education providers accreditation, schools accreditation, inspection bodies, laboratories, and certification bodies accreditation. So we are here today with Surade.
Okay, so you're able to see my screen and the title that we try to put it for this presentation, how to ensure accreditation through standardized phlebotomy practice. Okay, I believe many of you that you know a little or much about the accreditation, but maybe also many, I mean, this from my experience, they look at to the term or the medical terminology, phlebotomy. What's the meaning of the phlebotomy? I had yesterday a meeting also like we are preparing for another webinar, another organization, and the presenter there try to pronounce. The time they tell me, what's this? What's this? The phlebotomy. It is a phlebotomy. And this comes from the medical terminology. And it's good to, I would like to link everything up to the medical terminology. Phlebo, it is the vein. And Tommy is the incision of the vein. So this is the job of the phlebotomy, and it is interchangeable with the venipuncture. So to make the things like easy, like to understand what we are going to talk about. So the phlebotomy, you can put it in another term, which is the venipuncture. My name, sorry, I did introduce myself. My name is Uday Al-Ubaidi. I'm the president of MedLab Tech Academy, and MedLab Tech Academy established 2020 based in Canada as an online platform helping the students in the lab to challenge the national examination. And now we have many other programs, and we are distributing our programs all the world. Okay, so let's move here. The seminar objective, understand how standardized phlebotomy impact ISO 15189 accreditation. And ISO, it is the standardization. It is national, international standardization. 15189, or we call it sometimes 15189, it is the standardization, comes from the ISO for the clinical laboratory. And as I mentioned earlier with Dima, recently, 2 or 3 months ago, we completed a program or a course about the 1518 9 ISO program. So here today, we're going to try to link the phlebotomy to the 1518-9. And everyone working in the lab, working into the accreditation field, is very important to know what's the meaning of this accreditation. Identify ISO. clauses linked to phlebotomy. So, as I mentioned earlier, 1589, it is for the clinical laboratory, means for everything that is related to the clinical laboratory. From the starting, and I love this because in my life, I spent like more than like 25 years into the field of the clinical laboratory. Established, I can tell in my life, maybe 3 labs from scratch. From everything, from the place, from the document, from the people, from the equipment that we brought. So when I studied the course of the 1589 with AAA, uh, uh, all these things comes in my mind. I said, what if? What if I studied that before? How is my performance would be? How's the document I able to document? Very important. How the documents I able to like prepare. So this is the beauty of their knowledge. Sometimes, yes, we do things. We don't have that much experience, but we do, and there we are learning, which is perfect. But what if that you know these things? I mean, you studied, isn't that in the terms of the academy's terms, you studied, then after that you practice it. So it's going to be very amazing. This is one point. The second here, recognize how CLSI standards ensure compliance. CLSI, the clinical laboratory standard institution, it's American institution, it is voluntary. And I would ask or encourage everyone, like how to be a member with the AAA, be a member with CLSI, especially if you are in the field of the clinical laboratory. Everything about the clinical labs, you're going to find it in CLSI. And when we put these two together, I mean, ISO 15189 and CLSI, you're able to understand the documents, you're able to know how to create these documents. So here is the beauty of having together ISO with CLSI, and that's what we are trying now. We built a course in the academy is related to the clinical laboratory management. And in this course, the idea of the course is to prepare the people exactly how I mentioned that I've been involved in to build like 4 labs in different countries and different cultures and different level of these labs, private and government. How, like, if someone studied that course, has the knowledge, when there is a chance to be into the process of the accreditation or establish a new things, what the steps that we go through to do this such kind of job. So the course that we done with it, and we gonna launch it very soon. It is about the clinical laboratory management, and we put together ISO 15189 plus the CLSI to let the lab people understand these two. ISO is gonna give you the frame. CLSI gonna tell you how to do it. When there is a question here from ISO, CLS is gonna tell you how to do that. So that's why we try to put them together to build a new course into the academy. Learning strategies for the implementation and the audit readiness, and that's also very important. And also, I can tell you, I've been into, through even like into the academic level, I've been into like the audits. When we established, I remember in CDI College in Ontario, we established a new program for a medical laboratory technician. And at this time, to launch their program, that should be an organizations like AAA or AAA, they have to come to look at to the program, to look at to the location, the place, the equipment, the instructors there, their accreditation, all of these things, to give like the permission or the license to run the program. So this is what we are calling it the audit. If you are a person like the steps that is related to the 15, 18, 9, and you know how to do it through the CLSI, so it's going to be very easy for you to go through the auditing and to move forward. Okay, why accreditation matter? Accreditation, because of represent the accreditation, again represent trust, safety, recognition. Trust. Also from my experience and life into this field, many times, like if there is a critical result and you forward this critical result to the clinicians, the physician, the specialist, and they back or they ask how it come. It's like, this is the trust. When you have the accreditation, you have the steps that you're gonna walk through it. It can tell exactly. This is a true result. We call it into lab art, clinical lab art. We call it a true. This is a true result that it represents the situation of the patient. And the people, when they know that you have this kind of the accreditation, they can say yes, because they are following the system. They are following the standard. Safety. When we follow the safety, and safety here is related to the people who working in the lab, and the co-workers. Safety for the patient, and the safety of the patient here, there are two parts here for the safety of patient. The way, because we are trying to link it also to the phlebotomy, so the phlebotomist here contacted the patient. So they are working closely to the patient. They're gonna draw blood. If the phlebotomist does not have the right competency, accreditation, are they gonna practice into the right way? If that phlebotomist not involved into the standard system, are they gonna practice? I mean, we are not questioning here, but imagine someone like that does not have like any like kind of accreditation and coming to draw blood. And I personally, I draw a lot blood, not just into the education. No, in the real life from patient, I draw a lot. And sometimes the patients, they're trying to like find themselves, because you are dealing with needle. It's not easy. They are like they're trying to find out, like, are they like in the right hands? This person gonna deal with them in the right way? So they are asking like very polite like question. It's asking, how long you have been doing this job? So when you are saying, should so tell the truth here, like yes, I've been doing 1 year, 2 years, 4 years, they're gonna say, oh yeah, that should be fine. Means that you know that. This exactly also give it you the accreditation when you are doing that. Also the safety here for the patient, which also this is very, very important. The result. What if like we issue a result that is not a true result, which does not represent the patient situation? Is this going to impact on the patient? Yes, of course. And one of the things that here I would jump to it here, which is 60 to 70% of the laboratory errors occur into the phase of the pre-analytical. And this comes from the National Laboratory of Medicine. It is American organization. The status means if we're gonna say here 100 error, more than 50 comes from where? From or in which phase? In the phase of the pre-analytical. Who's doing who's involved into the pre-analytical phase? The phlebotomist. The phlebotomist and the job of the doing a phlebotomy, it is involved. That's why this paragraph or this sentence or this quote, I'm always, when I have a lecture in my academy about the phlebotomy and the training, I started with it. I start with this quote, which is 60 to 70% of the laboratory errors comes from the pre. That's why we need, it's very important to have a competent and qualified phlebotomist to do the job. And also, I had like a conversation with a colleague that they are saying the AI now, they are taking all the jobs. That would be like true, I mean, in the future, but no one can take the job from the phlebotomist to do the. Yes, it can be in the art of the clinical laboratory. The samples that we're going to use it into the test, yes, would be less than what we are collecting now, but still as a job of a phlebotomist doing the phlebotomy, still is not like intimated by the AI. So ISO 1518 ensure the laboratory competency and the consistency, and that's why, yes, we need it. And also speaking about the trust, and I may like jumping here and there about like my life experience. I found it like for my students, they like that because they are saying, yes, like you are giving us whatever like you involve in positive or negative. And I can tell you, one day my brother back home asked me like, I need to do this, I need to do that, which laboratory or clinic that you would recommend. And I said, I look at it, then most of these in the area where's my brother, most of they don't have the accreditation, so how can I recommend? And I found one, it has the, I think this CPA, the College of the American Pathologist accreditation. And I said, okay, go ahead, go to this lab and do the job there. Why I said that? Why I said that? Because the accreditation give the trust, the accreditation give the safety, and it is that lab. It is recognized because of the accreditation. So here, back here, the phlebotomy is the foundation of the diagnosis, the accuracy. Why we are saying here that the phlebotomy and the phlebotomist are very important member into the lab team, because they are the first who gonna conduct the patient. If we like away from the phlebotomy, phlebotomy is sample. When you do the phlebotomist, what do? They collect the sample. What if, like, a surgeon in the surgery, and they need to collect a biopsy? What's the biopsy? It's a sample, and they did not collect the right sample. What's gonna happen? It's the same that the here, like, we need like to open again and do all of these things that is related to the surgery and all of these things. My point here to tell, it is the sample that will represent the patient situation. And the blood, yes, it can represent the patient's issue from many chemistry, immunology, microbiology, many things that we would figure it from the patient's blood. So if I am the phlebotomist and I do have the competency which is coming from the accreditation understanding, and I am working into organization that they do have the accreditation. And here, when we are saying that this organization has the accreditation, means there is an auditing to my job, like I am doing it, means the point or the percentage of the error should be low. And something also here very important, like through my studies and my work, and through what I learned also from 15/18/9, we are trying to eliminate the errors, but there is no lab does not have any error. No, there is no, because I managed like I think two labs, clinical laboratories. I was the director there. You can like see like one day, it's very normal, regular day. You are doing your job, you go to have your coffee or whatever and do the job, and you are relaxed, you go home, you are relaxed. And one day, it is really hectic day. It is really hectic day. Even like you not think that whatever out of the environment of the lab. You want to focus here into the lab because it is act. So errors, and I can tell you many errors that happen in the lab that I have managed and how we dealt with. So errors, they gonna happen. But when we put ourselves into the accreditation 15/18/9, we are trying to eliminate the errors for what? For the safety of the patient. So ISO 15/18/9, 2022. Before that, it was 2015, and this is the last version of the not that much differences actually between them. Now is ISO 15/18/9, 2022. So we are into the latest version of this ISO. The two we have two key of pillars here into the ISO. Two things we're gonna look at too. The management requirement, which is clause from 4 to 6. The technical requirement, which is from clause from 7 to 8. Because we are talking about the phlebotomy, and we specified it for the phlebotomy. Phlebotomy, we mentioned that phlebotomy is gonna fall where? It's gonna fall into the pre-examination or pre-exam evaluation, examination process. And this gonna be clause 7.1, specifically for clause. If we gonna talk, and that's what we put into the course that we're gonna launch it. If we're gonna put these things into like the clinical laboratory, so we have to go with ISO from clause 4 till 8. All from class 4 till 8. If we need to focus onto the phlebotomy, so we're gonna focus into class 7.1. I hope I am not like running fast because we have time to stuck with it. If we gonna come to CLSI standard overview, so you're gonna find that the keys that is related to the phlebotomy, it is GB, general practitioner, 41, which is the venous blood collection procedure. Here, like if you, like the audit came and they ask, how do your phlebotomist, or they are interview the phlebotomist, how do you collect the blood? What do you use? to collect the blood. They can say we are using the vacuum tube, we are using needle gauge like this. Where they can then the audit, they're gonna ask, look here then, do you have any document to prove that? Where is your SOP, standard of practice? So here it's gonna come who? The ISO, the documentation. But how are we gonna document that? Come here to CLSI. CLSI gonna give you the steps of the procedure, which is the venous blood collection procedure. Here is the standard. Put them together, give it to your phlebotomist, let the phlebotomist sign. This is document. This document done. This is like one step, like you move into the accreditation of ISO 15189. GP 33, patient and sample identification. It's gonna tell you what do you need to have the patient and sample identification. Okay, I'm gonna ask for the driver license. Okay, which standard you are follow to ask for the driver license? I'm gonna ask for the date of birth, DOB. Who told you to do that? Which standard here? The audience can ask which standard you are following. My standard, it is the GP 33, which is patient and sample whatever they are saying. And actually here with the CLSI, they are asking to have two piece of identification, or you have one and you can ask and verbally that the patient has to back to you with the spell of the last name or the first name, whatever you will ask. So I'm gonna say like this. Okay, can you prove that? And here is the accreditation. Yes, I believe that you do the job in this right way, but can you prove that? Yes, this is the standard of the SOP that we are following. Okay, now the audience, what are you gonna ask? Can I ask, have this gentleman or the lady, the phlebotomist, know about the procedure? And I say yes. How can you prove that? There is any signature? There is any note that he or she read or understand this standard of a procedure? So here, like, look, these are two things like I'm trying to bring them together to build what? To build the trust, to build the safety, and to build the recognition. GP 44, handling and processing of the blood sample. Yes, in general, that we are handling the sample into the room temperature. If we are keeping the sample for longer of time, which is temperature that we have to keep it. Some of the tests that we have to handle them in a specific temperature, 37 Celsius. Okay, we know that. We know how to do this, but we're gonna ask, which is standard? And how can you prove that your team doing this step? How can you tell us that you are doing all these steps? GP 26, competency assessment, and your technician or your phlebotomist, what their competency, and are you holding like a training, and like annually, every 6 months, or when there is an issue happened, we are carrying a training for this kind of issue. Many things here that the ISO will not gonna tell you do this. ISO, they ask to show the document. How do you do it? When you need to know how to do it exactly, back to CLSI. CLSI gonna tell you what is that, what's the regulation, what all of the things that you have to follow. GP 32, non-conforming event. How to deal with it? It can be many. As I mentioned, in the lab, many things that it would happen in the sudden also. They said, like, when we sit together with the other colleagues working into the operating room or working in the ER, and they are saying, the lab people, that you are relaxed because you don't have like something can happen in a sudden, or no, you are working, and one of the machine fall, not work. The standard is not like that into the right reading. What you gonna do here? Even like with the phlebotomy, you try to draw blood, and you didn't get the blood. It can happen, and I'm always saying that, consider, for my students, consider every phlebotomy procedure you are doing is a new story for you. Bring the knowledge that you learn, that you know about the anatomy, the veins into antecubital fossa, 3 veins that we are targeting. 1, 2, 3. Don't be like a blind person and you are trying to know, be a knowledgeable person, and you know where is the mediacubital, where is the cephalic, and where is the basal. Which one you go first, which one go second, which one you gonna go third. With all of this, is it possible that you not get the blood from the patient? Yes, yes, it can. And it happened with me also. Okay, what's the regulation and what is the standard that you are follow here? And look here, like the experience, like, because I work maybe 4 countries in my life in the lab and in the clinical laboratory in different level. By the way, basically I'm microbiologist, but because I worked into the lab as a manager, as a director, and I am teaching now the phlebotomy and all of this, and I have my passion to the phlebotomy. That's why I'm here. So back to our point or story. Is it like possible that you would not get the blood? Yes, yes. What are you gonna do here? If you tried with the right arm and and you didn't get the blood, and the left arm you didn't get the blood, what are you gonna do here? You try 2 times. What's the standard that you are follow here? CLSI can tell you what the standard that you have to follow. Countries I work in, doesn't matter. 2 times you fail, you can try more. 3 times, 4 times, 10 times. There is no standard. Here, like, which is the CLSI standard. I mean, in Canada, we tried 2 times, done, that's it, stop. You have to ask someone else to come here to do the job. You are not allowed to continue with your patient. So such a non-conform or such an evidence, have you documented that? They can ask, have you documented this? That's the job here, how to do the document. And in the internal audits, which is quality management system 15, that it can explain the internal audits. Now we're gonna try to put them together, the ISO and CLSI, the perfect partnership, and that's what we are like. I can tell we try to put them together in the course. Sorry, to tell to give you the knowledge how to do when you like managing a lab, and when you like they ask, like the hospital manager or whatever, they're gonna ask you, we're gonna go through the process of accreditation for, let's say, AAA. What you gonna do here? If you like have the knowledge to put these 2 things, which is ISO and CLSI, all the other things gonna be easy. It's just like move, just work to do it. So when we combine ISO with CLSS, you get the complete system. ISO defines the requirements, which is the document. I would always saying that. ISO means document. Evans, if it's documented, that is. If it is not documented, it is not never happened, positive or negative. Okay. So ISO is the requirement. So define the procedure. Okay. It's gonna tell you how to do it. And that's why, again, I back to this point. That's why we put them together. When it comes to, like, now we are talking about the phlebotomy. When come any step that we are doing it into the lab, gonna ask what the requirements here from ISO. Oh, this what we have to. How can I do it? Back to or open CLSI. They're gonna tell you how the steps that you would go through it. Together, we're gonna ensure safe, compliant, and auditable practice. And again, the safe here that we are issuing or we are producing a true result, that this result represent the patient, and again the dealing with the patient that's safe, the dealing with the co-worker is safe. There are a lot of hazardous in the lab. It's chemical, physical, biological hazardous into the lab. If we are not following the like competency, not following the rules, and not following 1518, yes, we may cause harm, not just for ourselves when we are working in the lab, we may cause harm even for our co-workers. So ISO clause related to the clauses related to the phlebotomy. 7.1, the pre-examination, the sample collection, what to do to collect the sample. 7.1.1, the information for users instruction and the consent, that how we, in the phlebotomy, we are not collecting the consent because they said like if, and this is from the CLSI and ISO, if the patient sit on the phlebotomy chair and provide their arms, mean that they agree to go with this procedure. But here, is it just like that? No. CLS telling us you have to do the first thing you do it is to introduce yourself. To introduce, my name is 9123. I'm be your lab technician today. I'm be your phlebotomist today. I have to collect the blood from you because of your physician asked for the blood work. And here also, and they tell us in the terms of the ethics, sometimes the patient, many times, not just sometimes, why they are my physician. So what I gonna do here? ISO, they need to document that. CLSI gonna tell us what to do here. And in a very polite way, gonna say, I am the phlebotomist. My job here is to collect the blood from you. If you have any question, you can ask your physician or you can ask the nurse that is related to your case. And that's in very polite way. You cannot tell they ask for, like if they ask for fasting blood sugar, maybe do you have diabetes? Or maybe they suspect that you do have diabetes, and the patient they come down, no, I don't have, and they're gonna argue. And then, so when you put ourselves into the standard, look into the standard, we can do the job actually into the right, and that's what we are also teaching into the academy. Collection manual, SOP, and labeling. And here, ISO they're gonna ask, when do you label? And the answer here gonna come to CLSI. When I have to label. When the patient leave the place or the lab, or before. And here, when you are saying, I am labeling in the presence of the patient, that's it. That's it. We are following the right things, which is this SOP comes from where? From the CLSI. And that's again the beauty of combining together. And that's why we try to have this seminar to open the mind of the audience that how to put these two together. Handling, transport, and storage. How do you transport your samples? You have a contract with the courier that they are, what the facilities they are using there. What is your contract with your? These are the documents that you have to have it all. That's what I saw the audience they gonna ask for. Personal competency, training, assessment. Yes. I mentioned that at the beginning, the academy we created to help the student when they conduct the national certification exam. In most of the countries, it's not just you are graduated from college, university, or whatever you would practice immediately. No, you have to go to the organization that govern that this professional to tell that I need to do the exam to get your certificate. This is the competency. This is the training to tell that I am able to do this job. And if you know what is written into the certificate after they finish from any of these organizations, they are saying like, a phlebotomist has the entry level to do the phlebotomy. Look, the entry level to do this job, okay, means that it's able to do this job. So these are documents. And when it comes to the accreditation, I saw it is international. But still, the labs, they need what? They need the local accreditation. And if that the local accreditation, they can ask the same, how to do this? They're gonna back to CLSI. So look how these comes together to build these strong things for your lab.
I'm sorry to cut you off, Mr. Uday. I know it's been almost 50 minutes.
I can give me, oh yeah, give me 5
I
minutes.
know. Of course,
Sorry
take
for
the
that.
time.
Sorry for that. Sorry, but
Never,
yeah.
never,
For the
please.
question, for the questions. Yeah. So CLSI standards here, the GB41 is for the venipuncture site preparation, order of withdrawal. I don't want to go through order of withdrawal, patient ID, to identification, as we mentioned, handling, mixing, temperature and control. And here that mixing is not shaking, we have to mix. Training competency checklist, and the GB32, the error management, the CAPA logo. Patient identification, two, identification, name, BOD, or ID, confirm verbal and visual label tube in the patient presentation. A serious and non-confirmed method in accreditation, which is misidentified. So we have here a serious non-confirmed method. Site preparation, handle hygiene and gloves. Use 70% ISO. Why 70% and alcohol? Let it dry. Very, very important step here. Avoid the pre-palpation after the cleaning. All this comes from the CLSI GB41. But who can ask about it? ISO gonna ask about it. follow order of draw, follow the CLS. I order for the draw, mix tube, gentle, and I'm sorry because they don't have time. I would explain the order of draw with the meaning of the order of draw, prevent the hemolysis and different filling. Following this order, prevent the cross-contamination of additives and ensure the accuracy result. Labeling, label immediate, not afterward, include the patient information. Sample transportation, keep upright, temperature control, and sealed. These small steps protect the sample and, more important, protect your laboratory's reputation for reliability. Staff training, initial and annual training, competency assessment, and observation, training record, observation, checklist, and assessment form are your proof of the compliance. Non-conformative, identify, investigation, and document, issue, apply CAPA, record the outcome, the log. The goal isn't punishment, it is the learning. Internal audit, conduct regular internal audit, include the phlebotomy process, and use finding to improve the SOP. And the common pitfalls, labeling error, hemolyze, and trained staff, and missing document. These are very common. In implementation checklist, update the SOP, conduct training, perform the audience, track the CAPA, and document every step. The key takeaways: ISO defines what to do. Look, ISO defines what to do. Defines how to do standardization, build safety, and accreditation. Accreditation isn't just about passing an assessment, is about building system that protect patient safety and laboratory credibility. And now for the questions.
So, thank you. Thank you, everyone who attended today and participated. We really appreciate your attendance and interaction. Thank you, Mr. Uday, for your
Thank you
efforts
very
and
much.
your valuable information. We really appreciate that, and hopefully we'll meet up in upcoming events. So please stay tuned, and whatever questions you have, please email us at our email. I'm gonna send it here one more time, info@aaa-accreditation.org. Thank you all, and I wish you a really lovely Sunday. Bye-bye.
Thank
Take
you
care
very much.
all.
Thank you. Thank you. Bye-bye.
Bye-bye.
Bye.